As the needs and demands of the healthcare field grow and change, so do the methods in which we have to address those changes. With serious shortages of traditional providers, we look to creative solutions such as the medical home model and the chronic care team. Central to these creative solutions is the role of the community health worker. Community health workers are working on the front lines of public health and are increasingly recognized by major medical associations.
A community health representative provides culturally sensitive health education and outreach to high-risk communities.
A CHW works to promote wellness and health both in individuals and communities.
La promotora puede comunicar con el paciente en el lenguaje de ellos. A promotora can communicate to their patient in their own language.
A CHW supports health providers as a valuable member of a health care delivery team.
A CHW functions as a force multiplier, expanding the capacity of a clinic to manage and treat chronic disease.
Community health workers come from diverse communities, cultures, and geographic locations. They all work to promote equal access to health care.
What makes me passionate about being a CHR is that I'm able to be here on the Pueblo with my tribe and working for my people.
Being a CHW to me is important because this is the community I live in, and I see the impact that we have every day working with patients and the rewards that they get from working with us.
My goal as a promotora is to help the patient stay compliant so we can reduce or prevent or maybe even delay the onset of diabetes complications.
You know, it's been a great privilege and a lot of fun working with the ECHO program to develop the entire concept of providing training for community health workers. As we've done that, we've often talked about how innovative and creative the approach is. But for many of us, as an example here in New Mexico, a lot of this is part of our tradition and history. My great-great-grandmother, Adelaida Duran, was a community health worker in the sense that she was a partera, a midwife, and a curandera, a healer, in the little village of Chupadero, New Mexico, north of Santa Fe. She worked in the community with her hands and helping people with their births of their children, as well as their ongoing illnesses in a very hands-on way. That's exactly what the ECHO program is trying to accomplish in training community health workers throughout the state to be hands-on people in their communities who are from those communities and can provide the care in a very culturally appropriate kind of way. We have a huge gap here in New Mexico between the need for primary care and our access to primary care, and community health workers are one of the key strategical approaches for filling that gap.
Project ECHO can enhance the quality of healthcare through telecommunication and can strengthen and expand the role of community health workers statewide.
Project ECHO's mission is to develop the capacity to safely and effectively treat chronic complex diseases in rural and underserved areas. Project ECHO utilizes technology to bridge the gap between urban healthcare specialists and primary care clinicians in rural and underserved settings. The ECHO Community Health Worker Training Initiative pairs the success of the ECHO model with the potential and power of CHWs to improve public health.
The objectives of the ECHO Community Health Worker Training Initiatives are to provide community health workers with the expertise and skills to become force multipliers as part of the chronic care team, to empower trainees with extensive training to assist in the management of chronic diseases, to teach and practice application of clinical skills, and to develop and improve communication, teaching, and advocacy skills. ECHO's Community Health Worker Training Initiative is built on the core competencies CHWs need in order to work as part of the healthcare team, including bridging the disconnect between communities and the healthcare system, providing culturally appropriate and accessible health education and information, advocating for individuals and communities within the health and social services systems, assisting people in getting the services they need, providing informal counseling and social support, providing direct services such as patient assessment, history taking, foot exams, vital signs, healthcare screening tests, and building individual and community capacity.
Project ECHO has designed a highly rigorous community health worker training program for diabetes specialists that uniquely integrate face-to-face, hands-on, and interactive teaching with distance learning, and case-based relevant adult learning methodologies. Participants go to Albuquerque for an initial intensive training period, followed by 6 months of teleconferences and video modules. After that period, graduates continue to connect with Project ECHO via weekly teleclinics and continue to consult on difficult patient cases. The training is ongoing and interactive. This training model is also being adopted to other diseases and patient needs for community health workers. For example, ECHO is creating specialty training in addictions and preventive care. Healthcare facilities, both state and nationwide, have recognized the potential of using community health workers in traditional and innovative ways. Las Clínicas del Norte in El Rito uses community health workers to facilitate a teamlet care model. This flexible method negotiates care between patients and providers.
The promotora is a community-based educator. She will talk to the patient about their everyday lives and their lifestyle and what they can do to manage their own disease. The promotora benefits the clinic by extending the educational opportunity for the patient. It allows us to move on and do some other things that we can do, and allowing the promotora to do what he or she does best, which is to help the patient manage their own lives.
The teamlet care model increases the number of patients seen per day while expanding services being provided. This strengthens both the quality of the care as well as financial sustainability. Laguna Acoma uses community health representatives to facilitate the group visit model. This model embodies a culturally appropriate approach while also promoting patient education, emotional support, community capacity, as well as financial sustainability.
The role of the CHR is as a really important intermediary between myself and the patients. CHRs really are your link to the community. They open doors for you. They give you the cultural information that you need to better reach and engage patients. And I think also because they're from the community, they're really invested in it.
Like the teamlet care model, the group care model uses CHWs to maximize the number of patients seen with a commitment to cultural appropriateness and, again, financial viability. El Centro uses the warm handoff model. Community health workers and providers work side by side as a team during patient visits all through the day. Providers focus on the specific clinical needs, while the community health workers focus on the one-on-one disease management, emotional support, and patient education. So like other models, a community health worker works as part of a team, and this increases the number of patients being seen, creates the opportunity to bill, and improves the quality of care while helping clinical operations to run more smoothly between the patients as well as the providers. Community health centers should be mindful that they are part of the federally qualified health center program, which allows for the cost-based reimbursement activity that occurs every single day. The way that applies to the use of community health workers is that the providers, the physicians, nurse practitioners, and physician assistants can use community health workers in such a way that they can appropriately and effectively bill for the encounters that they're having for each and every patient, while at the same time using the handoff model to bring community health workers into the picture. Now, the providers are fully aware, I'm sure, that to have a billable encounter, it has to be face-to-face, there has to be independent medical judgment involved, documentation has to be excellent, and appropriate care has to be provided. But as long as those characteristics are fulfilled, then the community health worker can be part of that medical encounter, which then involves a bona fide billing activity. And given that the FQHC reimbursement is as generous as it is, that can lead then to adequately covering the expenses of having community health workers in the clinic. Community health workers are highly effective public health workers. With rigorous training, they can be used for their clinical and interpersonal skills. And as an integrated and recognized member of a healthcare delivery team, a community health worker can improve quality of care in a financially sustainable manner. Project ECHO's unique training model uses technology, best practices, and a case-based learning model to thoroughly train community health worker specialists while maintaining a low cost and yielding a high value. Project ECHO hopes to build relationships, foster collaborations, and expand community health worker potential in order to strengthen healthcare in New Mexico.